Of barriers, when you ask the 70% that meet criteria for disorder who don't go to treatment, almost half are talking about low perceived need. I thought this was just part of my life being an example of that. That was just part of my life. And there's a couple different ways to get there. Some are people experience it almost like the frog being boiled slowly, that the symptoms emerge more slowly enough over time, you don't kind of realize how bad it's gotten. Other people may have a stressful onset where they know, whoa, I feel very different than the way I used to feel, but it was probably just that stressor, and then it develops a life of its own, but because it started in the context of something else, people don't attend to it. Third grouping is also, we tend to judge so much on how we're doing by how our colleagues are doing, our family members. So if mom has a disorder and you have a disorder, it's a little bit less noticeable that, yeah, I need to get out and do something about it. Now, once people go for treatment, we get up to number 2 here, almost 75% have this desire to handle it on their own. Sometimes it's almost a moral responsibility. One should handle these sorts of problems on one's own and not go to treatment. Third category, people also assume sometimes that treatment won't work, and often they know someone, like, Aunt Edna, she went to treatment. She didn't get better. So why should I, right? So lore, the buzz about treatments and whether treatment works is a big deal, keeping people away. Number 4 is a classic that we know well, stigma, because of concerns about what other people may think of this. There's Michael, I think he's going to the EAP, the fear that may happen. These 4 are all sort of cognitive belief system barriers. The last one are just access to care. How hard is it to find a person to go to wait out the waiting list, to get a schedule at a time you can go to drive to wherever they are, to wait for your appointment? And we have these listed as if they're separate things, but of course they interact. The difficulty of getting to care to start dragging you back. And if you have concerns about stigma, that's going to lead you to drop out more early.